would set the respiratory rate, our pressures, our volumes, the oxygen level that we want.
Brandy Bielek is the Director of Respiratory Therapy at Memorial Health.
So respiratory therapists, they actually run the ventilator. They recommend settings to the doctor. COVID is a highly respiratory disease. So from minute one, they're the first person that's at the head of the bed when a patient needs to get a breathing tube. They're really kind of a nurse for the lungs.
Bielek started the job just about a year ago.
There was about 55 cases when I walked in the building.
Not long after Memorial was setting up this tent in anticipation of a COVID surge. The tent is long gone, but COVID is not.
So when we talk about intubation, the ET tube, this would be hooked up to the ET tube. So this is what's connected to them to breathe.
Bielek says her staff of 100 respiratory therapists are still working night and day and hand with doctors.
I would say that right now there's about 8 patients that are on a ventilator with COVID.
Over the past year, respiratory therapists have been an integral part of the medical team.
So some of these patients have been with us for months. From the beginning, some of the patients were sicker, and we got to know families and we got to know the patient very well, sometimes through Zoom.
She says it is stressful for patients and families if a ventilator is needed, but there have been many successes.
So the best story is, when you have a patient that you didn't think was going to go well, and all of a sudden you see the day that they get to see their family again and they get to leave this building.
But it's not all been happy endings, and that's why she says respiratory therapists are still working long hours to honor the ones that couldn't be saved.
Because that's what we're here to do, is make you better and help you. So when we can't do that, it hurts our heart. So my therapists have been through a lot.
Joanne Merrigan, WSAV News 3 on your side.